it's getting.
Yes.
Okay. So, Dr. Farrell just said he's taken some time to go through your medical records and stuff from the hospital, and he has a few thoughts.
Your urinalysis looks normal over the past few times you've been there.
My urinalysis
looks normal the past few times.
So I don't think for any symptoms you've had recently that they are a urinary tract infection.
Yes.
You don't think I have?
Not currently.
No.
You do empty your bladder based on what we've checked today.
But see, she's not emptying her bladder. Even just now, like, she's been to the bathroom twice since we got here.
And it doesn't mean she's not emptying. She can have an urge to go.
Well, so I'll just share this with you. I don't know if it's in the notes, but when I took her into the ER on Sunday, for instance, she went to the bathroom at home, then she had to go to the bathroom, we got there, and then she had to go to the bathroom again. And we encourage her just to take your time. We're not in a rush, because half the time she's up, washed her hands, and it's like, I have to go again. So what was interesting was after she had gone all those times in a row, in the ER, they put a catheter in her, and immediately it filled up 500 milliliters of urine.
Yes, I recognize that from time to time she can have that. I'm just saying today she doesn't have a lot of excess in her bladder.
Then why is she going so often? And she's drinking so little. In fact, we're forcing her to drink.
Sure. So she can run into both things. As people age, their bladder becomes less stable and squeezes more often. Like people can have heart arrhythmias, people can have bladder instability, which is one source of urge and urge-related incontinence. We can try some medicines in terms of to see if that reduces how often she goes without reducing the bladder's ability to squeeze. Okay, so I think that's probably the direction to try initially. The other source, yes, people can absolutely run into times where they don't empty their bladder for one reason or another, and that is a little bit of the seesaw in this conversation. So there are certainly tests we can do to identify how well her bladder squeezes, but you have to provide active input with that. There's a catheter in the bladder, a catheter in the vagina. They have pressure sensors on them. It's fairly involved, and I don't know that that's a great plan. And so initially, we're probably better off trying a medicine that reduces how often she has to go. And because the mechanism is one that enables the bladder to relax,
I'll help you with this. What I'm gonna do.
I feel dizzy, Annie.
Let's see. You okay?
Yeah.
Did it just come on?
Yeah.
Do you feel like you're?
try to slow your breathing.
Take deep go.
And if you want, take the mask off.
She's triple. She's got the booster and everything.
I'm not worried about that. She was COVID negative anyways.
No, through your nose. Let it out through your mouth. Good job.
Slow them down.
Yeah. Okay. Just go slower. Slower.
Okay.
We're also seeing 3 other doctors this week on her wildly swinging blood pressure.
So it's unfortunately the urge to go frequently doesn't mean she isn't emptying her bladder. It simply means she has an urge to go frequently, and a lot of foods and drinks can cause that, but also, unfortunately, as we all age, the bladder can do that on its own without good rhyme or reason. And that's a known concept. And there are times when the bladder just doesn't want to squeeze well, which can lead to some of those intermittent situations of having a lot of urine and having difficulty getting it out. We don't have medicines that make the bladder squeeze better.
Mm-hmm.
We do have medicines that reduce the bladder's ability to squeeze. That would not be a good choice for her. So there's really only one class of medicines that helps it relax, reduces that urgency and the frequency to go, but doesn't impact the bladder's ability to squeeze.
Okay.
And so we have some samples. I would recommend trying those for a month, and let's see where she is.
Okay. Now, is there? Can you tell, or how can you tell that it's maybe not like, we get everyone's opinion, which is sometimes helpful, but like a collapsed bladder or something collapsing maybe the pelvic wall?
So, I guess the collapsed bladder is not a thing. Are you trying to describe prolapse, where the bladder sort of dropped down into the vagina?
Perhaps.
Okay. That's a pelvic exam, and we can do that. Since she's emptied her bladder here, I would almost guarantee she has some amount of prolapse.
Mm-hmm.
Fixing that is a surgery,
Mm-hmm.
and thus far, the presence of her symptoms don't really support the idea of that necessarily being the problem.
Mm-hmm.
If she ever complains of having to push tissue back in her vagina, then we're maybe talking about something that actually matters.
No.
Most women, after they have children
Yeah.
or are in their 40s, have prolapse, which is some part of their organs in their pelvis encroach on the vagina, which is a potential space, and sort of push their way in a little bit.
Mm-hmm.
Symptomatic is the word you care about, because that's the one that actually matters as to affecting whether it impacts quality of life. So
Mhm.
if someone has to push tissue back into their vagina to urinate, that would be symptomatic prolapse.
Okay.
So if she ever feels a bulge at her vagina or a lot of pelvic pain persistently, or hey, there's something at the opening,
Mhm.
that's prolapse that might matter.
Now, what would be causing when she says she feels pain?
I feel so dizzy and
Would you be more comfortable out in our front area?
what is
Would you feel more comfortable sitting in the lobby and having this conversation?
Well, I don't know if we can do that with the other patients there, but
Right.
I can have it with you.
Oh, right.
why do I feel so dizzy?
And we can certainly take her blood pressure again.
Let's do that.
But
So can you answer a question for me?
Yeah.
So when you feel like you have to go to the bathroom,
Yeah.
where does it hurt?
Oh, I don't know. Sometimes in my vagina.
Sometimes.
Yeah, yeah.
On a scale of 1 being it doesn't hurt at all to 10 being it's awful pain,
And
how would you rate it?
no, that's hard to say. I don't know. Maybe 5 or 6.
Okay.
Yeah.
What would be causing that?
Offhand, without an exam, I don't know. And so with doing a pelvic exam, I maybe find an answer, or maybe don't. So because I have no test for pain, right?
Mhm.
There's no urine or lab tests
Mhm,
or radiology
right.
tests for pain. So
I feel so dizzy, Annie.
so I would hold off on the pelvic exam today.
Yeah.
We'll probably try next time.
Okay.
Let me go.
What do I have to do for the dizziness?
We're here to talk about your peeing today.
Yeah, yeah.
Okay? I want to put your feet up here though.
But I think from a pain standpoint,
Yeah.
there are lots of muscles. There are lots of things in the pelvis,
Mm-hmm.
and it's not a urinary tract infection based on urinalyses.
Mm-hmm.
She does empty her bladder, at least here today.
Mm-hmm.
And you might find that a medicine that makes the bladder not squeeze as hard. There can be a lot of referred bladder and urethral pain from a bladder squeezing and wanting to squeeze a lot.
So that's what the medicine will help with.
That's what's designed to help with, and we'll go from there.
Got it.
Okay. We'll get someone to check your blood pressure. Okay.
Okay. I thought I had one more question for you.
Are we going there then?
Very soon. Very, very soon.
Yeah.
Okay. It's okay. Just you're fine. What the heck was my question?
I feel so dizzy.
I know, Mom. If I think of it, I'll see if I can
You
ask
get another minute or two. Okay.
All right.
Come back in
Thanks.
if you need me to.
Great. Thanks.
Okay.